Bismillah Rahman Rahim. On the request of the larger community, they requested times and again to us, to Pakhtun Professionals Canada, to bring someone an expert on the Omicron, the COVID, which is a new variant and affecting a community and the entire world, and people are suffering. So, in that context, we brought the Dr. Ibrahim Khan, which Dr. Suhail Khattak will introduce him and welcome him. And in this session, Dr. Suhail Khattak, which is developmental pediatrician, and Dr. Sajjad Ahmad, which is molecular biologist. Those are more technical background people, and I will ask community related questions from Dr. Ibrahim Khan. So Dr. Suhail Khan, welcome him, and then we go to the session because he has another program soon within an hour with the CBC. So we want to ask him as many questions as possible. Dr. Suhail Khattak.
Thank you, Dr. Banan. Dr. Ibrahim Khan is a medical graduate of Khyber Medical College with specialized education in public health and infectious diseases from Germany and US. Currently working as a regional public health physician in Saskatchewan. And I must add that I was very pleasantly surprised. He's, mashallah, well spoken, has got numerous um, um, uh, speaking engagements. I've seen his references both in print and media. Welcome, Dr. Ibrahim Khan. Here we are 2 years into the pandemic and faced with the fifth wave of this Omicron virus or Omicron variant, which has resulted in increased hospitalization and increased cases and new restrictions. Can you please update this latest chapter on the great battle between the virus and us? What is going on?
Oh, thank you so much. First of all, I would like to thank all of you, Dr. Sahel and Dr. Sajjad and Dr. Manan, and your entire audience for inviting me to this session. And certainly we can talk a lot about, what has been talked about, COVID versus Omicron. So first of all, thank you very much for this invitation. And I would like to say Happy New Year to all of you, because this is perhaps my first session in the new year. So Happy New Year to all of you. Hope you had a good time with your families. Yes, so since January, we are dealing with a new sort of variant and very rapidly surging everywhere around the world and in Canada, and particularly in every province in Canada. So I think people are hearing that this is a new variant. And there are a lot of new things about the new variant that we all need to know. And whether we are concerned about ourselves or whether we are concerned about our families, our community, or as a country. So I think there's a lot to know about the Omicron, what makes it so different than COVID. So it is very different than COVID, although it is from the same family of viruses, but it is a very different virus. It's 5 to 10 times more transmissible. And so that makes it very easily spread across the family or in a community or across the country. So since it was first diagnosed or detected in South Africa, it has spread to almost every country on the globe till today. So I think its transmissibility is the biggest concern. Second, that it has immune escape properties. So for example, if you have immunity from either a previous infection or a single or a two dose, that is not enough. So you have to have a certain protection. So the best evidence, the best science, the current science is very clear about it, that if you have two doses of COVID vaccine, I'm just talking in the context of US and Canada, because we have Pfizer, we have Moderna, we have other vaccines. And particularly when it comes to Omicron, the mRNA vaccine. I hope everybody know the mRNA term and why is this so different vaccine. So I think the mRNA vaccine has a very documented evidence that is very effective, particularly if you have the third dose. So if you have the two doses and you're concerned about Omicron, you are not protected. So I want to be really clear that if you really want to protect yourself, your elderly people, your pregnant women, everybody in the family, I think it's very important that you immediately check you have the booster dose or not. So if you had second dose earlier this summer, or earlier last like winter, or if you have 2 doses and you have more than 3 months, I think you should immediately go for this booster dose. So that third dose, the current science actually provide a very good evidence that with the third dose, your immunity reaches 70 to 80%, and that is particularly protecting you from severe infection, like severe sequelae, severe complication, hospitalization, and death. So I think you have to take it very seriously. People are thinking it's a joke. It's not a joke. And Omicron for you may be mild, but Omicron for somebody around you may not be mild. And so we need to be very clear that we are protecting people by giving them the best education and the best science in the current time. That is showing that 3 doses are, you have to have 3 doses. Second, you have to wear a mask, a medical mask. And if your occupation or your job is a high risk, if you have a high risk occupation, for example, you're a dentist, you work in a hospital, you work in a clinic dealing with patients, or you're a receptionist, or you are public facing and you're dealing with crowd, then you have to have a very well fitted mask. And if you have extra risk, then you have to have N95 mask or respirators, for which the Public Health Agency of Canada, they say that you don't have to be fit tested. You can just put it on your face, and you just put it on your face as long as it fits well on your face and protect you, and you can see the breathing in and out. I think that is the way the
So,
well mask is described for Omicron.
that's an important point you're bringing out, because a lot of people have that perception that if you're not fitted, that the N95 mask. But you're suggesting that it's okay as far as it fits. Okay, you don't need to go for the fit test. Am I
Yeah.
correct?
So there is two things here, very two important points that I want everybody to note. First of all, if you are working in the community, you are not a doctor, you are not a nurse. You, if you are working in those settings like a hospital, clinics, you deal with patients, then you have to be fit tested. Then you have to go that training, and there are really open guidelines now on the Public Health Agency of Canada website, on Health Canada website, that what is the well-fitted mask for a healthcare provider. So that is a separate category of people. So they have to have well-fitted training, and it has to well fit for them. But if you are not in those category of people, then you can just put it as you want, but you still have to, make sure that it's tightly sealed around your face and your mouth and nose. So you don't need that well-fitted criteria if you are working in a community setting. But if you are working in a hospital clinic, then you have to have really well-fitted mask, and you have to have the shield and those sort of things as well.
No, no, I understand. What thought was from the general public perspective. They don't need to be fit tested. They need to have. That's what your point. And
Yeah.
yeah, that's great.
And
Now, one
the best
question I want.
mask, yeah, the best mask is that whatever you can get your hands on. So for example, if you have access to a surgical mask or a medical mask, that is the best mask, and that should protect you if you use it properly. For example, you seal it around your face, and you can see the movement of the medical mask in and out when you breathe. That is the time you can say, yeah, I have put it properly.
So I just going back. There was one important point you mentioned about the booster shots, and I want So, what is the current recommendation or guideline based on how quickly should you be getting booster shots? So if you got your vaccination or the second dose 6 months ago or 4 months ago, when should you get your booster shot?
Okay. So if you, I have to be really clear here that if you are immunocompromised, if you have certain condition, for them, the time between the second dose and the third dose is very short. Okay, so keep that in mind. If you have certain condition, if you have HIV, if you have hepatitis C, if you have on kidney dialysis, if you have kidney condition, or if you have other or cancer treatment. So if you are in those categories of people, so the time interval between the second dose and the third dose is very short. But if you are living in a community that the high vaccination rate is very high and there is no Omicron, then you can certainly wait a little bit. But I think nobody's waiting these days because Omicron is everywhere and people are congregating, people are going. So everybody wants the third dose as quickly as you want. As long as you don't have acute symptoms, like you don't have cough, fever, you can just go anytime and get the booster shot, and that is the only way to protect yourself.
So essentially, your recommendation is get the mRNA shot
Yes,
if you can,
yes,
and get a booster as soon as you can. If you're high risk, you definitely need to be
quicker,
on the priority.
quicker,
Okay.
quicker.
Okay, Dr. Khan, let me go a little bit back. Okay, in 1918, we heard about the Spanish flu, then the SARS. I have two questions here. One is that what is how do you differentiate between COVID or Omicron from the Spanish flu and other past pandemics like SARS, etc. And the second, my question is, why Canada have it? Like Omicron, there is traveling restriction, there is a lot of awareness, there is the first, second dose. Why Omicron came to Canada? Why we have it? The Canada is a safe country. If you see the statistic, the safest, the happiest, on every aspect, the marking index is on the top in the world. So why Canada have it? That's my question, particularly the Omicron. COVID, yes, it came because
Okay.
it's true, but why Omicron we have it in such a high strength?
Okay, so really good questions, and I hope I give you the good answer, and if I didn't, so please remind me. So first of all, number one, pandemics have been happening every century. But the most recorded pandemics goes back to Spanish flu 1918. There is a lot of documented evidence on that, how it devastated the global community at that time, and the way people were treated. There was actually no antivirals, no antibiotic at that time, very little knowledge about the infectious diseases. So the impact of that Spanish flu was tremendous on population. So yes, every 30 to 40 years we see a pandemic, and as Dr. Suhail mentioned earlier, he was here in Canada when he was dealing with SARS and H1N1. So after the Spanish flu, I think the biggest documented pandemics that have been witnessed and seen is the if you would recall, after that was the Middle Eastern sort of virus. There was a Middle Eastern specific to the Middle East area. There was a virus which actually didn't came out of the Gulf area. Actually, it was contained very quickly and it was eliminated. Then H1N1, then actually SARS, and then H1N1, and now COVID. So pandemics happen, and every time when there is a new virus introduced to human population, where you don't have the immunity, people get sick, people die, and because the knowledge about that virus so there was no knowledge about COVID. So when the COVID was introduced from Wuhan, and I think we can talk a little bit about where this particular virus came from, like from Wuhan in one of the Chinese province, where there was a fresh livestock market where animals of all sort, like any animal you can name it, they were living in a very distressed sort of situations in a close proximity to human beings. So the secretions were crossed, respiratory secretions were crossed, a lot of biological fluids were crossed between human population and the animals. And there's a scientific evidence that from that crossover from animals to human in Wuhan province, the virus jumped from animal population to human population, and it spread very quickly. By the time it was reported by the Chinese health ministry, it was too late. It has spread to the whole world. So I think the pandemic happens. Pandemic is not a new phenomena for anybody who work in public health or infectious diseases. They happen. The problem is that the ability to detect it is very limited in developing countries, like in Middle East and developing countries. Even country like China, who is manufacture every product you can think of, but even they were late. And then it took time for World Health Organization to declare the pandemic globally. So that delay in time let it spread very quickly to the world. And the question about why we have here is because I'll just give you one quick example of Toronto Airport. Just take the example of the Toronto Pearson International Airport. Just name any country and just watch how many flights come from that country every day, every week, and then count the number of passengers that come. And for before COVID pandemic hit, there wasn't any screening, so people can jump on the plane and can be here anytime. So the global travel is the main source of this transmission. And imagine how many flights come from Pakistan through different airlines. Like, there's a Pakistan International Airlines, but there are many other airlines that bring passengers from Pakistan, India, around the world. And that is the case everywhere. So I think the answer to your second question is that it is the global travel. People are so mobile that, this morning I'm here, but next morning I'm in a different country, and I'm congregating and I'm meeting with people across so many like paths and gates, that it's easy to spread. So the global travel is the only source of transmission. And by the time South Africa found Omicron, it was spread to 95 countries already, and it was just a matter of detecting it. So I think global travel is the reason why we have Omicron here.
Sajjad Ahmad Saab. Sajjad,
Yeah.
any question?
Dr. Ibrahim, thank you very much that we are lucky to have you. Actually, we were just talking about the Spanish flu. As far as I know, I think it just lasted for 2 years. Some of the scientists and immunologists, they are of the opinion that this year, 2022, may be the last year for this epidemic. So what is your take on this? Are we just the end of this pandemic, or it will continue for another years?
These are just predictions. There is nobody in this world, no scientist, no research, no crystal ball that can tell you when this pandemic is going to be over. These are all speculation. These are all predictions, which are not true, and no science can tell you that. So first of all, the hope we have that, I mean, you guys asked that question already, and we can maybe talk about it right now, that, so that's how pandemic comes. A new virus is introduced to human population. They spread quickly and attack millions and millions of people around the world, for which you don't have immunity, you don't have the vaccine, you don't know much. So these are the ways pandemic comes, and nobody in this world can tell with the precision that this pandemic will be over by June 2022 or June 2023. There is no way anybody can predict that. What we can tell you is that, okay, wherever the vaccine uptake is going up, the virus is going down. Wherever the vaccine uptake is going up, hospitalization deaths are going low and low and lower. So that is one thing. Second, when a new virus spread around the world with that rapidity and with that frequency and magnitude, I mean, everybody has COVID around the world by now, and from that you get natural immunity. So you haven't got the vaccine, but you got the natural infection. So from that you get the immunity. So the scientists believe that the reason in South Africa the wave was quick and short. It went very quickly up, but it came down very quickly with the spread, because it's a poor area, no vaccine up. First of all, there was no vaccine in South Africa, and then if there was vaccine, the uptake was extremely low, like maybe 6%. By the time Omicron hit them, everybody got COVID and they got that immunity. And so scientists believe that the reason the impact in South Africa was low is because everybody had COVID and they had the natural immunity. Now, after the natural immunity, if you get the COVID vaccine, then your immunity is very robust. It's very strong. It can protect you from severe complications. So
exactly, I think that's really a good explanation for this, and that's the reason that scientists are of the belief that that once we just increase our immunity with the addition of these vaccines, so maybe there is a ray of hope that we will just end this.
The reason that hope is jeopardized, the hope that we had that we will eliminate this virus and we will come out of this pandemic is jeopardized because not every country has access to vaccine. Like many countries in Africa, many countries around the world don't have the vaccine. We're talking about the boosters here. Many of these countries don't have the first dose. So global inequity in vaccine is the key to end this pandemic. So as long as we have the global inequity in vaccine, we are not going to end this pandemic. We're going to see new variants. So that's why Canada, US, and many other countries and UK have pledged that they want to give some of the surplus vaccine to other countries, so that if you protect somebody in Pakistan, if they come to Canada, and you know how many flights come from Pakistan. So if people in Pakistan are well vaccinated with booster and everything, when they come here, they won't bring the virus and they won't spread it. So I think that is another thing that we cannot hope this pandemic will go away that quickly.
Okay.
Dr.
Good.
Khattak,
Good.
Dr. Khattak, any
Uh,
question?
so I think it's a great point on the vaccine equity, but let's just talk about then one other subject. You mentioned something about the natural immunity. So if you get, so one question people often ask is that I got Omicron now, so how long will I be immune, and when should I get, or should I think of getting booster?
So the quick answer to that is that if you had COVID, don't just rely on that immunity. If you had COVID infection, you have to have 2 doses plus one booster. Then you can say you are protected. And still, after the booster dose, you have to wear a mask. You have to be still careful where you go, whom you meet. So my advice would be that just don't rely on that natural immunity that will protect you, because the virus is changing. So your immunity may be to that variant that you got infected with. So now it's Omicron. It doesn't accept that immunity, and it has immune escape properties. So I think I would suggest to people that if you had COVID infection, still get the COVID vaccine primary series and then the booster shot, and that is the way you can protect yourself.
So the other question,
Dr. Khattak Sahab, one question, a person sent me a question that was asking, what is your belief on spirituality, like religious belief that some people think that because of inequalities and injustices and crimes and, like people are dying from poverty, and that's what like religious belief is that Allah, yeah, God sent these pandemics just to punish people, and they to realize the more about humanity and kindness and caring and be together. What did you say on spirituality? And another question, if the same person sent me that how effective is the 3 dose of booster for this Omicron? Like if these booster or these Pfizer's and Moderna, is it for the Omicron? If it is for the Omicron as well, how effective it is? And he is also asking why not now the research and the worlds are ready, the WHO and all these different organizations, the world has money, now they are sensitive to it. Why not they develop vaccine so quickly now for the Omicron? Because now they know what Omicron is all about. So they can do it in days, in
Okay.
weeks, rather than
Okay. ओके, इसका जवाब आपको उर्दू में देता हूँ. ओके,
okay.
स्पिरिचुअलिटी. तो स्पिरिचुअलिटी ये है कि हम सब मुसलमान हैं और हम सब अल्लाह पे यकीन रखते हैं. और अगर शफा हमारे 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 यकीन के मुताबिक, कुरान के मुताबिक अगर शफा आती है तो वो शफा कुरान और दुआ और अल्लाह की इबादत से, और सुकून भी उसी से आता है. और स्पिरिचुअलिटी हमारे मज़हब में तो बहुत ही स्ट्रॉन्ग बिलीफ सिस्टम है, तो वो तो बहुत इम्पोर्टेंट है. लेकिन उस स्पिरिचुअलिटी के साथ साथ इसका ये मतलब नहीं है कि आप वैक्सीन रिजेक्ट करेंगे, आप थेराप्यूटिक्स नहीं लेंगे, आप टेस्ट नहीं करवाएंगे. स्पिरिचुअलिटी के साथ साथ कुरान में शफा है, और कुरान के हर आयत में शफा है, और उसको पढ़ना चाहिए, और उसको हर चीज़ के लिए, ना सिर्फ कोविड के लिए बल्कि हर मर्ज़ के लिए शफा है उसमें. तो वो तो मेरे सबसे दैट्स द मेन स्टेटमेंट कि कुरान में जो शफा है वो सिर्फ कोविड के लिए नहीं, हर मर्ज के लिए शफा है उसमें. तो वो तो हमारा ईमान है, वो तो हमें पढ़ना चाहिए हर वक्त, हर 5 नमाज के साथ. वो तो दैट्स द स्टैंडर्ड, दैट्स अ गिवन. देयर इज नो टॉक अबाउट दैट. इसके अलावा 3 doses of mRNA vaccine will protect you from Omicron, definitely. 70 to 80% of immunity, it does give you that. And yes, when you have seen there were 5 waves of this pandemic, right? And in each wave, we were dealing with Delta, Lambda, Gamma, and many of the other variants. So currently, before this wave started, Delta was the most dominating strain, okay? And that was circulating. And Delta was kicked out very quickly by Omicron. So when one virus comes, they kick out all other variants. So if you had immunity to Delta, I certainly, with the booster dose, you will get more immunity towards Delta, even if Delta is circulating in your community, or Omicron as well. So that immunity will protect you from all variants previously or now with the current Omicron as well. So that was your third question. The question about vaccine for Omicron. So yes, there is a tweaked vaccine coming. So we will see that whether the current 3 doses will protect you from the severe infection, deaths, and ICU admissions. So that there is evidence on that. Now we will see that we have another month to watch this, how this peak is going to go. We still don't have a peak yet. So we're going to see the peak, and we're going to see whether the peak in Canada would go as quickly down as it went in South Africa or in United Kingdom or in US and other countries. So if our peak is going down and we are seeing less and less hospitalization and our vaccine 3 doses are going up, it means we are battling the virus very effectively. And that would perhaps be the downward trend of Omicron. Now, whether we will see another variant after this, it's not known. Nobody can tell you that because we have still a lot of countries with no vaccine. So maybe a new variant will emerge there that will be even more powerful than Omicron. Nobody knows that. So we need to.
Dr. Ibrahim.
And yes, there will be a tweak vaccine for Omicron, particularly coming by March or April.
Dr. Ibrahim, as we are talking about these booster doses and all those doses, and we also know that that this is a variant or these viruses just has a great mutation capabilities. So this is a question from the community that if this virus is just mutating all the time, so what are the purpose of these vaccination or boosters? So if a variant comes in which is totally different from its original, so how these booster doses or this vaccination will save us from infection or even just death?
Yeah, so I think that is the battle we have to fight if we all want to survive and get a handle on this and see the end of this pandemic. That is the way out of it, and it's just not COVID that we have to deal with. We have dealt with many viruses like that. For example, the flu vaccine, the HIV vaccine, the HIV virus, the hepatitis C virus. So we have dealt with many viruses like that in the past, and many viruses that we didn't even know and attack the human population. So I think based on the current science and based on the current knowledge that we have to get the booster shots. We have to watch how this virus is going to behave further after Omicron and after 3 doses, how long that immunity would last. And it depends how the global population moves. You can't stop. It's very devastating for economy. Just imagine if we have to stop just imagine that when the Omicron started spreading, Canada put a ban on 10 countries. And did you see the impact of that ban on those 10 African countries? It was so unethical, unhuman, and devastating for those countries. So unless you stop that, which is a financial suicide for many countries, people have to travel. People have to go. You have to go for business. You have to operate. You have to provide services. You have to run the hospitals. You have to go on with the life, and you cannot stop. Waiting that we will have to quarantine ourselves for another 6 months at home. Nobody's going to work, no jobs, and then we will get. So that is not possible in the current
Okay, Dr.
environment.
Khattab, do you have any question?
Yeah, just want to make sure that we clarify when you mentioned that the booster is giving you 70-80%, the data you were suggesting was that prevents hospitalization. You'll still get the infection, but infection will not be as severe, right? That's the purpose of the booster.
Yeah. So we must say that no vaccine in this world, this vaccine and the previous vaccine we have, is perfect, 100% perfect. No vaccine is 100% perfect. So you have to keep this in mind. And the reason we give a tetanus shot after 10 years is because the tetanus immunity goes down. The reason you get MMR shots or any other vaccine that related to travel is because immunity goes down with time. And so is it with COVID. With COVID, the problem is that the COVID immunity goes very fast down. It doesn't last long. So that is a problem. And we have to deal with that, right?
Great. So just one, then other question is, a lot of people have that in their mind, is what can I do to protect myself? Are there supplements? So there's a lot of question on this supplement, this, but in particular, I want to see what your opinion on vitamin D and vitamin C and vitamin K and zinc as well. People are saying about those supplementations. What is the role of that in all this?
Okay, so the blanket answer is that all these ingredients, vitamin D, vitamin K, zinc, ginger, garlic, a lot of talk about that in the social media about, if you eat this or you eat that, multivitamins, supplements. These are all good things, and you should take it if you can. And they do provide you strength, and they have a really good herbal medical effect on blood circulation, immunity, strong. So there are good things. I'm not saying they're not good things. You can take that as routine, as recommended by your doctor. But the science around therapeutics for COVID is also quite evolving. So you have seen in the third or fourth wave, we didn't have the vaccine, so the vaccine came. So vaccine is a big ammunition or a tool to combat the to combat the virus. So in addition to the vaccine, that is very effective and effective than many other vaccines, we have now monoclonal antibodies. These are particular antibodies taken from people who had the infection and given to people who are immunocompromised that don't have the immunity. So the monoclonal antibodies are available in hospitals to the doctors, and they do give that. But I think what is the most exciting thing right now is that everybody is very excited about is the antivirals for COVID. So on the U.S. side, antivirals have been approved by FDA. On the Canadian side, we are expecting an announcement soon that the Health Canada would approve the antivirals for COVID treatment at home. So it will add a lot it'll add a lot, reducing the pressure on the hospital, because you can go to the doctor and get a 6 to 7 days treatment regimen, come home, take it like the way you take any other antibiotic. So I think that is another exciting news that is coming, that as soon as that antiviral is approved on the Canadian side, doctors would be able to prescribe it, pharmacists will be able to give it, and it will be available in hospitals and clinics and pharmacies. And it has a very strict criteria who can get that. Not that everybody can go and get an antiviral for COVID. It won't be like that. But I think there would be availability of that for certain patients who are at risk of dying or getting complications. So I think that will really change the game of COVID. And better masks and getting vaccines certainly would bring the end of this pandemic.
So you're
So,
talking
Dr.
about
Han,
just one sec, one quick. So you're talking about the molnupiravir, which was just approved in U.S. and
This is the CBC reporter, and I have to go.
okay.
So I may come back, but I may not. So I think I thank you all for the questions, and we can have another session sometime. But good questions, and there is so much to talk about. So thank you very much.
Thank
thank
you
you
very
so
much.
much for your time, Dr. Khatak. Dr. Khan, thank you so much. Okay, so Sohail Khatak, Dr. Khatak Saab, you can elaborate on it.
But my question was just in regards to what he was talking about is molnupiravir, which is very similar to, you have heard, the Tamiflu. Remember when when the flu H1N1 and all this came out, they were recommending the Tamiflu. So this is molnupiravir, which will come out, and it will yeah, that's I was just wanted to see what his from the public health perspective. Obviously, what he was saying was that and not everyone will go and take. There will be clear guidelines and criteria. I think what he meant was that when you get the infection, or you're in contact, you start experiencing symptoms, is when you should be taking that medication. But I don't think that there is a guideline to it yet. It is approved in Canada. I know that for sure. It's available through the hospitals as we speak. However, it will be available to public as well. It's just a matter of production control and all that. But anyways,
डॉक्टर खत साहब आप कम्युनिटी को हम डॉक्टर इब्राहिम खान really it was his blessing that it was we are thankful to him. He came, and I know he has another interview in half an hour right away now with the CBC television. and we will bring him again. But can you give community any message, Dr. Khattak, for any general message in Urdu and Pashto, and then we can end the program and we will bring another talents another Sunday, the community. So any message in Urdu?
मैसेज ये कम्युनिटी के लिए कि जो डॉक्टर साहब बोल रहे थे बड़ा इम्पोर्टेंट है कि वैक्सीनेशंस बूस्टर और ये कहना कि जो ये ज़्यादा विरुलेंट नहीं है, बात ये है कि प्रोटेक्शन और ये फैलेगा, एहतियात करना ज़रूरी है, सारी एहतियाती तदाबीर हैं उसको जारी रखें, कंटिन्यू रखें, अपना गार्ड लेट डाउन ना करें और जो कुछ कर सकते हैं अपनी तरफ से एहतियात ज़रूरी है। और तो ये मैसेज था।
पश्तो में भी दे दे तो फिर हम प्रोग्राम ख़त्म कर देते हैं। डॉक्टर इब्राहिम खान पेशावर से था, पख्तून था। डॉक्टर सज्जाद अहमद माशाल्लाह भी पख्तून था। डॉक्टर सुहेल खटक जो कि डेवलपमेंटल पेडियाट्रिशियन है, मेरे ख्याल में एजिक्स में इनकी अपनी हॉस्पिटल या क्लिनिक है, क्लिनिक में काम करते हैं। तो आप भी पख्तून है। हमारी असल में ये जो पख्तून प्रोफेशनल कनाडा है, हम पख्तून टैलेंट को कोई किसी को भी जो कम्युनिटी को देना चाहे, किसी भी कल्चर से हो, किसी भी जुबान से हो, लेकिन खासकर पाकिस्तानी हो, हम पख्तूनों की टैलेंट्स को उजागर करते हैं, पख्तूनों की टैलेंट्स को सामने ले आते हैं ताकि कम्युनिटी में इनकी इंक्लूसिवनेस हो, इंटीग्रेशन हो और मतलब हमारी अपनी एक कंट्रीब्यूशन भी हो सोसाइटी में। तो सज्जाद अहमद खान, you can say something about what did you can conclude from Dr. Ibrahim Khan discussion, like what is, because you are
I can conclude this in Urdu because our mostly our audience they speak Urdu or Pashto, so I think I will conclude in Urdu.
Okay.
अल्हम्दुलिल्लाह कि हमारे पास ऐसी डॉक्टर्स हैं कि जिन्होंने जिनकी बहुत खिदमात हैं सोसाइटी के लिए, जैसे सुहेल खटक साहब हो गए, डॉक्टर इब्राहिम साहब हो गए, तो उन्होंने बड़ी मुफस्सल गुफ्तगू की, लेकिन चूंकि उनको कहीं और भी न्यूज़ चैनल पर जाना था तो अनफॉर्चुनेटली वो कंप्लीट हम पूरा नहीं कर सके, लेकिन फिर भी उन्होंने बहुत सी ऐसी बातें की जो कि हमारे नाजरीन के लिए बहुत मुफीद साबित हो सकती हैं। सबसे पहले उन्होंने ये बताया कि वैक्सीनेशन बहुत ज़रूरी है, वैक्सीनेशन के बाद बूस्टर भी बहुत ज़रूरी है, क्योंकि ये ओमिक्रॉन जो वायरस है ये इसमें मरज़ लगाने की सलाहियत बहुत ज़्यादा है। ये मतलब ये है कि ये कंटेजियस बहुत ज़्यादा है। तो ये इसका एक ही तरीका ये है कि इसका हम वैक्सीनेशन के ज़रिए से कंट्रोल कर सकते हैं और अपनी इम्यूनिटी को और या क़ुव्वत मुदाफ़ियत को मज़ीद बढ़ाने के ज़रिए से कंट्रोल कर सकते हैं। और जो लोग वैक्सीनेशन के ख़िलाफ़ हैं और जो या नहीं करना चाहते, तो उनके लिए ये एक बड़ा ही इंतहाई सबक था कि वैक्सीनेशन इज़ द ओनली सोल्यूशन। ये एक ही सोल्यूशन है इस पेंडेमिक से जान छुड़ाने के लिए या इस मर्ज़ को अपने फैमिली और अपने प्यारों को बचाने के लिए वैक्सीनेशन बहुत ज़्यादा ज़रूरी है। और उन्होंने ये भी कहा कि प्रिवेंशन बहुत ज़्यादा ज़रूरी है। प्रिवेंशन का मतलब ये है कि आप अच्छी तरह मास्क पहने, अपनी कम्युनिटी में अगर आप कहीं जाना चाहते हैं तो ज़रा एहतियात कीजिएगा। और उन्होंने ये भी कहा कि अगर आपकी जो देसी घरेलू जो चुटकुले हैं, जो फॉर एग्जांपल कावा है या मतलब है कि आप कोई और जिंक या सप्लीमेंट लेना चाहते हैं, तो उन्होंने ये कहा कि ये भी बहुत ज़्यादा इसके फ़ायदे हो सकते हैं। इसके अलावा उन्होंने हमारे चूँकि हमारा ईमान है कि कुरान शरीफ में शिफा है और अल्लाह ताला ही शिफा देने वाले हैं, तो उन्होंने इनका भी जिक्र किया कि कुरान शरीफ और पढ़ना हमारे लिए बहुत ज़रूरी है, न सिर्फ कोविड-19 के लिए बल्कि तमाम अमराज के लिए हमें ये पढ़ना चाहिए। और ये हमारा ईमान है कि हम कि शिफा अल्लाह की तरफ से है और कुरान शरीफ में अल्लाह ताला ने शिफा रखा है। तो मुख्तसरन उन्होंने एहतियात की बात की, वैक्सीनेशन की बात की और कुरान शरीफ और ये जो देसी टोटके हैं ये भी उन्होंने उनकी मुखालफत नहीं की बल्कि उनको सपोर्ट किया। तो हमें चाहिए कि हम इन बातों का ख्याल रखें और इंशाल्लाह हमें अल्लाह ताला से ये दुआ है कि हमें इस पेंडेमिक से छुटकारा हासिल करे और दुनिया पूरी तरह से दोबारा फ़ाल हो जाए और इस मरज़ से अल्लाह ताला हमारी जान छुड़ाए और दोबारा दुनिया फले और फूले. I think over to Dr. Manan sir.
डॉक्टर खटक साहब पुख्तनों तो समय से भी तो कुछ दे दे. Just talk to Pashtun is a big community. No पुख्तनों तो समय से जोड़ कर वाले. Give a message to Pakhtun and then you will also Sajjad bhai give a message to Pakhtun in Pashtun. Then we will close the session.
सही है.
पुख्तनों लपاره خو بس صرف یو سمپل میسج دی چې ویکسینیشن کوي او بوستر ویکسینیشن لګیدلې خپل د بوستر شاټ ولګوي دا کووډ دا نوې ویریانت چې کوم دی د دې خلاف امیونټي چې کوم دا دغه دوه ویکسین دوه شاټ نه چې کوم دی نه جوړیږي نو خپل د ویکسینیشن امپورټنت دی هغه د احتیاطي تدابیر چې کوم پروفیشنل پرسنل پروټیکټیو اکوپمنټ منګوي هغه متعلق هغه ډېر خبر وکړه او د غیر علاوه هغه دا وایي چې کوم سپلیمنټیشنز دی هغه کې څه برای نشته هغه تاسو کول غواړئ ضرور کوئ او بل چې کوم دی نیچرلی د الله او د الله د کتاب قرآن پر دغه کې برکت او دغه کې چې دغه شفا ده دغه متعلق هغه خبره کړې و. دا مونږ ته پکار دي چې مونږ دا ټول مشورو باندې عمل وکړو.
सजाद भाई आपने कुछ अल्फाज कहे फिर उसके बाद मैं आप दोनों का शुक्रिया अदा करता हूँ और इब्राहिम खान का भी. डॉक्टर सुहेल भाई आपका मुझे पता है कि डेवलपमेंटल पीडियाट्रिशियन का चूंकि मैं अर्ली ईयर्स में 18 साल से जॉब कर रहा हूँ मुझे पता है आप लोगों की वेटिंग लिस्ट का. आप स्पेशलाइज डेवलपमेंटल पीडियाट्रिशियन तो जो बच्चे ऑटिज्म या डाउन सिंड्रोम या स्पीच एंड लैंग्वेज या कोई भी डेवलपमेंटल इशू हो आप लोग उनके पास आते हैं और उनकी बड़ी लिस्ट है 6 महीने से लेकर 2 साल तक और उसी में आप इसने टाइम निकालना और फिर फैमिली का दिन भी है संडे. रियली आई अप्रिशिएट कि मैंने आपको सिर्फ एक टेक्स्ट मैसेज किया एंड यू वर सेइंग ओके आई विल बी देयर. सजाद अहमद साहब आप भी लास्ट नाइट हॉस्पिटल से आए हैं और मतलब आपका भी तहे दिल से शुक्रगुजार हूँ कि आपने मतलब सोए भी नहीं है बिकॉज सारी रात आपने हॉस्पिटल में गुजारा है. तो अपनी सेहत के साथ साथ आपने फिर भी कहा कि नहीं जब कम्युनिटी की बात आती है तो सजाद भाई हमेशा और डॉक्टर सुहेल खटक हमेशा आगे आगे होते हैं. कहते ना नहीं कहते जब भी कम्युनिटी की बात आती है. तो दोनों का बहुत शुक्रिया. इब्राहिम खान का हमारे साथ बहुत क्वेश्चन आए थे. टन्स ऑफ क्वेश्चन लोगों ने भेजे थे लेकिन 12 चूंकि उसका एक और इम्पोर्टेंट टीवी इंटरव्यू था तो चले गए. तो मैं आप दोनों का बहुत मशकूर हूँ. तो आप पश्तो में मैसेज दे दे और फिर हम इंशाल्लाह
بس زه خپل پښتنو ورونو ته د ټول مخکې خو ورکلې وایم چې السلام علیکم زما پښتنو ورونو. موږ ډاکټر ابراهیم صاحب سره او ډاکټر سهیل صاحب سره ډېر کولې خبرې وشي د کووډ 19 باره کې. هغه دا و چې کووډ 19 چې دی نو د کې به تاسو احتیاط ډېر زیات ضروری کوي. تاسو به ماسک خله به پټوي پوزه به پټوي او تاسو به دا ویکسینیشن چې دی نو دا د هغې دپاره تریاک دی ډېر زیات ضروري شی دی چې تاسو ویکسین ولګوئ او د ویکسین نه پس تاسو بوسټر ډوز هم ولګوئ. زه مخکې ورځو کې کلي ته تللی وم نو ما ته به خلکو وایي چې وی احتیاط کوم ما به چاته احتیاط کوم هغه به مړه ایمان دې کمزوری دی. نو زما پښتنو وروڼو زه تاسو ته دا وایم چې دی کې د ایمان سره زما دا ایمان دی چې دعا هم پکار ده خو دعا سره دوا هم ضروری ده. نو دعا او دوا دا دواړه ضروری شیونه دي. نو زه پښتنو ته زه دما دا خواست دی چې کله داسې څه بیماری راشي نو هغې کې الله پاک او زموږ حضور صلی الله علیه وسلم زموږ پیغمبر صلی الله علیه وسلم ته دا ویلي دي چې تاسو به دوا هم کوئ خو دوا سره به دوا هم ضروري کوئ. نو زما دا ټولو ته پیغام دی چې بھئی تاسو احتیاط کوئ. دا پینډیمک چې دی دا داسې عام مرض نه دی. دی کې تاسو ډېر ښکلي خلک د دې دنیا نه تللی شي او دا د دې بچاو ممکن دی. موږ دې ځان نه بچ کولی شو که موږ لږ احتیاط وکړو. موږ هغه ځای ته نه ځو چې کوم ځای کې مرض وي چې کوم ځای ته ځو چې هلته موږ پوره ماسک اچولي خپل ځان هم پټ کړي او یا د هغې دپاره چې کومې دوایانې راغلي دي چې کوم ویکسینیشن دی دا وکړو او دې نه علاوه تاسو قهوه څکلی شئ. دا چې کوم سپلیمنټس دي ډاکټر ابراهیم صاحب د هغې باره کې دا ووایي چې دا خبرې هم تاسو کولی شئ او اخره کې دا ووایي چې تاسو بالکل دم درهم کولی شئ تاسو قرآن شریف ویلی شئ تاسو دعا کولی شئ. نو زما اخري پیغام خپلو پښتنو وروڼو ته خپلو پښتنو وروڼو خویندو مشرانو کشرانو ته هم دا دی چې تاسو دعا سره دوا هم کوئ او دا زموږ ایمان دی.
तो बस आज तो कुछ लोग लाइव भी आना चाहते थे. उन्होंने कहा कि हम डॉक्टर इब्राहिम खान से लाइव में क्वेश्चन करेंगे लेकिन मैं माजरत ख्वाह हूँ क्योंकि वो चले गए तो अभी लाइव आने में मतलब है वो नहीं रहे तो हम उन सवालात के जवाब तो नहीं दे सकते क्योंकि वो असल आदमी वही था. तो हम اس دعا کے ساتھ کہ اللہ ہم سب ساری دنیا کو، سارے کینیڈین کو، ساری ہیومینٹی کو، پاکستانیوں کو، ہمارے پختون بھائیوں کو اللہ اس مرض سے محفوظ رکھے. ہماری دعا ہے کہ آپ خوش رہیں. انشاءاللہ پھر اگلے سنڈے کے ساتھ نئے ایک ٹیلنٹ کے ساتھ ملیں گے. اور ابھی ہم آپ سے دعا آخری کلمات کے ساتھ اجازت چاہتے ہیں. خدا حافظ.